course, let's then speak to Solidarity Fund's Dr. Nozipho Sangweni. Thank you so much for your time. Would you say the fund has fulfilled its mandate?
Good evening, everybody. I absolutely would say the fund has fulfilled its mandate. Remember, the fund was established as a rapid response vehicle. We were established to augment the government response to COVID-19. So it was a very specific and limited mandate, and it were not really meant to be a long-term solution. And we believe that we have worked with government, various partners, government, business, and civil society. And we really are a unique example of what can be achieved if we work in partnership and collaboration. And so we believe we've left the system stronger. The COVID landscape has changed. We are now shifting from a pandemic state to an endemic state. And yes, there will be seasonal transmission, but that will now be managed in full by the public system, which is much stronger than it was when we first started 2 years ago when the COVID pandemic hit. And so the public system will manage whichever variants may come. They will run the necessary programs and manage the virus accordingly. So yes, I would say very strongly that the Solidarity Fund has achieved its purpose, and we will go into dormancy. We're targeting that for September 2022, and we'll have a slimmed down board that will maintain that dormant entity and reactivate in another instance where a calamity of national impact should arise. So yes, we've achieved our mandate, and we're leaving the system much stronger.
I'm quite keen to find out from you. I mean, you were set up during a very difficult time in South Africa to perform a very difficult mandate. I wonder, as you look back, because you talk about going into dormancy and then potentially coming back for a different mandate in the future, what are some of the lessons that you'd say you had to learn during such a time? Because everything had to be done so speedily. We didn't have a manual. We've never dealt with COVID-19 before, but the work had to continue.
Yeah, absolutely. Really, I would say the challenge, and of course the learnings come from challenges. The greatest challenge, I would say, is balancing governance, balancing scale, agility, and speed. It's a complex environment. You're working with multiple partners. You have multiple contractual obligations that you need to ensure adhere to, and you're writing up the contracts as you go, as you enter into these various partnerships. So I think that really is a great lesson. And in terms of that, we believe that the lessons that we have learned should be shared. And so part of our project as we close down is to create case studies and write up the lessons, because we were not perfect. As you say, I mean, it was a complex time and lots had to be done very quickly. So we are analyzing ourselves, self-assessing, and writing it all down so that it can be there and available for the new Solidarity Fund, should it be required, the reactivated Solidarity Fund in future, and any other entity that might want to learn in terms of how to run a rapid response vehicle in a very complex environment. And it's not only the governance and the scale and balancing all of that. I think also just the decision making in a complex environment was also another key learning.
And when you then look back, let's talk about, of course, big numbers. We talk about, the Solidarity Fund had to do some work in all the 9 provinces. Let's talk about how much has been done to assist those in need during the time of your existence.
We've had significant impact as the Solidarity Fund. As of 16 March, the COVID Fund received a total of 3.8 billion rand. That includes interest and VAT returns. That money was allocated, 3.7 of that money was allocated across 53 programs. We have about 100 million that is still to be allocated, which is just under 3% of the total received. The 53 programs spanned 3 pillars. We had the health pillar, the humanitarian pillar, as well as the behavior change pillar. Later on, in July of last year, after the riots, we established a fourth pillar, and that one was called the Humanitarian Crisis Relief Fund. And there we received donations of 497 million, and we internally shifted 100 million into that fund. And so there was a total of 597 million that was available for the Humanitarian Crisis Relief Fund. But back to the COVID fund, the 53 programs that I spoke about, which were spread across the three pillars, the health, the humanitarian, and behavior pillar, the bulk of the funds, 2.8 billion, went into the health space. And so we have really supported the health system and strengthened the health system. We invested significantly in procurement of essential equipment. And when we speak about essential equipment, we're talking about things like ECG machines, dialysis machines, ventilators. We procured all of this and distributed it to hospitals across the country. We also manufactured ventilators, working with various partners, and distributed those as well across the country. We also got involved in vaccinations, and for us, the key was really to get that reach into the outlying areas. And so we established over 200 sites. We worked with what we name clinical operators. These are teams that go into the rural areas and do the vaccinations. And we're expecting that by the end of March, we would have reached 1 million vaccinations across these 200 sites.
All right.
So in total, we've disbursed 3.3 billion of the 3.7 billion that we received in the COVID space.
All right, Dr. Sangweni, I cannot wait to see what's next for you. Thank you so much for that and the update, of course, and being candid with us to talk about some of the lessons that have been learned during this time. We certainly do appreciate it. That was the Chief Operating Officer for the Solidarity Fund, Dr. Nozipho Sangweni.